Wednesday on the Rick's Smiley Morning Show. It's Wellness Wednesday, and we got the one and only Dr. MJ Collier is back to help you keep your health on track. Dr. Collier, good morning. Happy to have you.
Good morning, Rickey Smiley. Talking about that tooth that comes out in everybody in their 30s. That's pretty good. Good morning, Rickey Rock T, Special K, Gary with the T, Alfreda, and Brett. Thank you so much again for the opportunity to bring healthcare information to the listeners of the Rickey Smiley Morning Show. So, Rickey, today we're going to talk about a newly described dual pandemic. This pandemic is of diabetes and obesity that affects 3 out of 5 people. So what's causing this dual pandemic, Rickey? 38 million people have diabetes, with the largest portion of them being type 2. The prevalence of diabetes in the United States has increased since the 1970s, with rates tripling between 1990 and 2010. So in the past 30 years, we've seen changes in ways to treat these disease states. Particularly, we had medications that were effective in controlling your blood sugars, including insulins. But the problem was a lot of those therapies, particularly insulin, would enhance your ability to gain weight and make you gain weight and enhance the obesity pandemic. So now we got new therapies, and the struggle, we can counterbalance these things. Those are SGLT2 class drugs. You hear about them all the time. The two most popular are Jardiance and Farxiga. SGLT2s make you urinate out extra sugar. And what you do with that sugar, you also urinate out the calories associated with that sugar. And so they make you lose weight passively. So they are very effective in addition to controlling your blood sugar, but they also help lower your risk for cardiovascular disease, heart attacks, and strokes. This is a major improvement in the traditional ways we have used to treat diabetes. And then everybody's favorite new drugs, the GLP-1s, that's the Ozempic and Mounjaro. Everybody knows about these disease state drugs and the major benefit, which is weight loss. But they are also, and people oftentimes forget this, very effective in controlling your blood sugar and lowering your hemoglobin A1C. So when you have those disease states, obesity and diabetes, you can control them much better. You can get a great outcome from treating them. And part of this problem is that, Rickey, we are really hooked on ultra-processed foods. So starting in the 1950s, when they first developed TV dinners, they started tweaking food and adding the amount of sugar and salt that just made they gave food a wow factor. And people become literally addicted to it now. And so they chasing levels of satisfaction in that. We call that food noise. That's a new term, food noise, that keeps you craving food and keeps you eating long after you actually have felt full. But it's just because it tastes so good to you and your body just adjusts to it. So when we take those two things, the SGLT2 inhibitors and the GLP-1s, and combine them with what's now called continuous glucose monitoring, or CGM, that combination of three things not only reduces your weight, controls your blood sugar, lowers your A1C, prolongs life, but takes away risk factors that are associated with diabetes, like heart attacks and strokes, amputations, all of those issues. So if you have and have been diagnosed with diabetes, or if you're just overweight and you are not on that 3-drug combination, then you're being undertreated. And guess what, Rickey? Less than 10% of people that are eligible for that treatment protocol are actually getting it. So many people are still getting old school medications that they are just not having the best outcomes from their diabetes that they could. So there you have it, Rickey.
Yeah, all right, let's go to the phone. Y'all with Dr. Collier. Good morning.
My question is, every time I eat, I immediately have a bowel movement. What is the cause of this?
Okay, oftentimes that is dysfunction of the gut, particularly the gallbladder. And if you're eating foods that are difficult to digest or have a high colloidal effect, and that would be fried foods, fatty foods, greasy foods, those sorts of things that are difficult to digest, your body almost literally rejects them. One of the things that you would greatly benefit from would be adding probiotics to your diet. You put good bacteria in there, and then avoiding greasy, fatty, fried foods. So your caveat is, if it swims, you can eat it. If it flies, you can eat it. Your preferred method of food preparation is baked or broiled, not fried, and add a good probiotic. You can go to the website, lipodrops.com, get out Lipobiotics, and that will change your life.
Man, them probiotics, man, had me leaving church looking like I just slid into first base. Let's go to the next call.
when we were talking about, I heard the conversation earlier this morning about passing gas and holding it and the problems with that. When you have the probiotics in there, one, you don't have as much gas, so you're less prone to that. But more importantly, if you do, it's more fragrant, and so it's not so foul that it runs everybody out of the room.
My God, Dr. Collier, let's go to the next call. You on, Dr. Collier? Good morning.
I woke up this morning, and the bottom of the bed of my tongue is swollen. What does that mean?
That means you probably bit it overnight. That's usually customary, but there are viral infections that can do that as well. So I would brush your teeth very good and brush your tongue with your toothbrush, and then gargle with a 50-50 solution of warm water and peroxide, or almost any non-alcohol mouthwash will give you some benefit. If it has not resolved itself in 24, 48 hours, then, there are other things we need to check for, including infectious diseases.
I'm glad you answered that one.
I know before you went to it.
My mind ain't right. You on with Dr. Collier? Good morning.
Hey, my question is, my mom has been back and forth to the hospital maybe 2 to 3 times already in the past month, and she's been having signs and symptoms of high blood pressure, like 190 over 100. And with their signs and symptoms, she has slurred speech, dizziness, and memory. But the doctors can't find anything, and they're saying TIA. So what can we do more to invest in what's going on?
Okay, well, you have a diagnosis, the high blood pressure, so we definitely need to control that. So she's going back and forth. I'm sure they're giving her follow-up with a primary care doctor, a family physician, or an internist, even a cardiologist who can control her blood pressure. Then she also needs to be seen by a neurologist. A TIA, by definition, is a transient ischemic event. That is a stroke, basically. The only difference between that and a full stroke is that you get over it. So it's transient. It goes away. But that's a key indicator. If you have TIAs, that you are trying to have a stroke. So she needs to be evaluated to make sure she doesn't have any heart problems like atrial fibrillation or, coronary artery blockages from high cholesterol. She needs a comprehensive physical examination. And she also needs to do something about inflammation. She obviously has inflammation in the body. So a vitamin D at 5,000 international units per day and omega-3 fish oil would assist with that. But the primary treatment is getting that blood pressure under control.
Mm-hmm. Yeah, somebody had called here and was inquiring about one of my uncles. One of his legs shorter than the other one, and was wondering how he stay in such good shape. I told them, replied that he jogs on the curve. Let's go. We'll be taking more of your phone calls up next with Dr. MJ Collier, 866-9 Rickey, 866-9.
When you jog on the curve, you can only go one direction.
When you go across the street to come back,
you can't do it.
You can go across the street. All right, more phone calls with Dr. Collier. Up next, Rickey Smiley, the morning show.